Okay. So, just to give an introduction, this is Dr. Srinand Srinivas. He is my close personal friend, actually classmate. We did medicine together. We studied MBBS together in Bangalore Medical College, and we've been good friends ever since. He is a sports physician who has a diploma by the International Olympic Committee. He is a former India level swimmer. I remember during our undergraduation, he used to swim 14 kilometers a day. He has represented India at a national level. He has won medals at international events. And after becoming a sports physician, he has represented India again in various international meets. He is also an avid marathon runner. So he's kind of perfect for this topic.
Thanks, man.
So
yeah,
the whole
I get to embarrass me in public now. So. Right. Okay.
So the whole this Instagram live is as people might know, I do a lot of body contouring procedures. I do a lot of liposuction in people, and one question that I get from many people is, Doctor, how do I keep the fat from coming back? How do I maintain my weight? Or another thing is, what do I do with my diet? How do I control my diet? I've tried so many things, but it hasn't worked out. So while I do give answers to these to the best of my ability, I think Dr. Srinand would be in a better position to answer these questions. And
sure.
Basically, as a little bit of a background, in my practice, I would say there are like three kinds of patients that I see. One is those who are quite fit. They have a very active lifestyle and they have just a little bit of fat that they're not able to burn away. Second is those people who are active, but they are not as active as they could be because of various reasons. And or they have issues such as weight gain after pregnancy or hormonal issues, and they are not able to get rid of that fat. And the third, I would say, are those people who are not active at all, and they just come to me seeking liposuction as a quick fix solution. They think that liposuction is a weight loss surgery, and they get a lipo done and everything will be fine, which is not really the case. Liposuction can only do so much. It is a combination of with your lifestyle changes. So those are some of the things that we'll be discussing today.
Yeah, and like you said, it. Go ahead. Sorry to interrupt. Like you said, it's a holistic approach thing. You can't. It's one supplements the other, one complements the other. You can't. Just sometimes, unfortunately, just exercise isn't sufficient on its own, or just liposuction isn't sufficient on its own. It's always complementary. So, I mean, I'm quite sure all of you are wondering what a plastic surgeon and a sports medicine surgeon are doing together. Sports medicine physician are doing together. They actually, one where it's very contradicting fields. Nobody would ever associate the two. But then, what you're trying to do today is try and show you how, instead of, because I've seen. I mean, not just generally. I've seen surgeons who swear only by surgery. I've seen sports medicine doctors or fitness trainers who swear only by fitness training and say you don't need a procedure for that and thing. But there are ways actually we can work together and see how things complement. So yeah, moving on to you. So more than happy to go into it. But just to keep it simple.
One thing we can address is there's a misconception that only eating fat makes you fat.
Yeah.
People don't understand how eating carbs also makes you fat.
Yes. So, yeah, right. So, that's a good point. So, what we were... So, that's... apparently in the 60s or something, there was a study that... when they discovered that atherosclerosis or whatever the cause of heart attack was because of fat, people directly associated that eating fat causes fat. And the fat got a very unfair thing. But then I personally tried the keto diet. You've tried the keto diet, and we've actually seen improvements in So, just eating fat, yes, overeating fat can also translate into fat directly. But the biggest, from even as a family practice physician or a sports medicine physician, what I've seen is people usually who are overweight actually have a low fat diet and have a very high carb diet, highlighting your point. Because usually if your carb diet is not proportionate, or your carb intake is not proportionate to your activity or your calorie burnt physical activity, all that carb is, the body is going to be like, hey, what do I do with all this extra carb? I don't need to use it. The body is very smart that way. It actually stores more and more fats. I've seen people who, they say, I eat like one bowl of rice in the afternoon, one bowl of rice for dinner, and I eat ragi with that. These are all carb sources, but I don't even add 1 teaspoon of ghee. How am I becoming fat? So that actually, I'll touch upon that when we talk about stubborn fat, about that fat thing, why that carb to fat thing is very important. I'll touch upon it when we talk about stubborn fat. So
simple terms, it comes down to calorie deficit versus calorie excess. If you're eating more than what you need, than what you're burning away, then the excess gets stored as fat, regardless of what it is. If you're eating too much carbs or you're eating too much of it, it gets stored as fat. So, how do you break down this fat? What can you do to break down this fat?
So what can you do to break down fat is, so ideally you need to, your diet, so the typical, my formula when people come to, are you asking how do I break down fat, like from a lifestyle perspective, or do you want to know the biomechanics?
More like a physiological perspective. How does exercise actually break down fat? Like,
right.
Yeah.
Right. So, see, what you need to understand, one, fat is an excellent source of, what people need to know is fat is an excellent source of energy. 1 gram of fat uses about 9 kilocalories. Whereas 1 gram of carbohydrate, it uses about 4 kilocalories. But like everything in life, anything hard, anything that uses such a great source of thing, you need to work harder for it. It's not that easy to burn that fat. So the effort you need to put in to get that 9 calories out of that 1 gram of fat is a lot more. It's so much more easy. I mean, the body has to work a lot harder. So typically, like,
the body uses other sources first before it comes to the fat.
Yes, it is so much easier. For me to generate energy from carbs, it'll take me like seconds to minutes. Seconds. A 100-meter sprinter has no time to dig into his fat reserves and get into it. Whereas a marathon runner on the other side has plenty of time to, he's running for 2 hours, 2.5 hours. He has plenty of time to dig into his fat reserves and stuff. So the typical thing is high intense, short bursts of energy, high intense activities, and all depend a little more on carb metabolism. And typically low intensity exercise done over a period of time depends on fat metabolism. So that's how it works. And now the people, what they're doing nowadays is they're combining the both. When you do this, when you do high intensity activity for a while, what happens is that during that phase you're using your carbs, but your heart rate is still high for a good amount of time after that, for the next half an hour, 45 minutes. So what happens is when you do that half an hour exercise for that high intensity workout, you've used up your carbs. So now what happens is you've created that carb deficit. Your body has no other source but the fat. And then what happens is now your heart rates also come down to that low intensity level. So your body starts utilizing the fat. So that's a basic thing on how fat metabolism goes around.
Is there a known time limit beyond which the fat reserves are tapped? Do we know what that time limit is?
I think that it varies from person to person, because if you read the literature and books and all, people typically say glycogen, that's a storage form of carbohydrate. So people typically say that you run out of your glycogen reserves by 45 minutes or 1 hour into your physical activity. All this comes down to your muscle mass. It's a various factor, but it can vary from 45 minutes to 1 hour. Or it depends on your training, depends on how active you've been physically and all of the various factors. But approximately 45 minutes, 30 to 45 minutes is before you tap it.
Simple message is, for your exercise to be useful, your heart rate should be elevated for a prolonged period of time, for like at least like an hour or so. At
least an hour or so. Yeah.
So how you elevate that heart rate is up to you. You can do a low intensity workout for a long period of time, or a high intensity for a short period of time, which keeps your heart rate elevated.
Absolutely.
One good way for people to monitor what they're doing is to look at their heart rate. If your heart rate isn't going very high, then what you're doing is probably not going to be very beneficial.
That's true. But on that note, make sure your heart rate doesn't go too high also, so that we can wind up with other issues. So we don't want that to happen.
So we'll come to how to exercise safely. Now is a good time to come to the concept of stubborn fat, as you mentioned. So my understanding of stubborn fat is that fat has receptors for anabolic receptors and catabolic receptors. For the person, these are receptors which either increase fat or reduce fat. So
Right.
Proportion of these receptors is different in different people and different in different parts of the body. Fat in one part of the body can have more receptors for being burnt away. Fat in another part of the bodies can have less receptors for being burnt away. And this is something that you don't really have control over.
Right.
Would you say that?
That is correct. So, I mean, the anabolic receptor you're talking about is receptors to insulin. And because I'll just dig a little bit in the technical part of it.
Yes. Yeah.
Because insulin is lipogenic or anabolic, so it basically builds up fat. It helps the body store fat. Now, coming back to our previous thing about how we are talking about carbs and all of it. Now, I'm quite sure all of us know that insulin is a main thing to reduce carb levels in the body or sugar levels in the body. Mm-hmm. So typically what happens is when you have a high carb diet, what happens is the body starts producing more and more insulin, right?
Yes.
And starts producing more and more insulin. So whatever stubborn fat has, it's been shown that apparently stubborn fat has more receptors for insulin. It's more insulin sensitive, so it becomes harder and harder for us to burn. So there's more insulin in the body now. The stubborn fat's only going to get more stubborn because there's so much more insulin. It's just going to get more stubborn. So the biggest mistake I see people doing is that they exercise more, eat less. Exercise more, eat less. It seems to be a very common starting trend when people start to lose weight.
Yeah.
So they are just, when you exercise more, eat less, you're just signaling the body that, hey, we're going into it's just going to make the stubborn fat even more stubborn. Resistant or stubborn. Yeah, exactly. So this is something, you're right, we don't have control over it because I've seen people, they work out really, really hard and then you still have the tiny bit of love handles over there, or the men, like I think that's your forte. I mean, men typically tend to have a deposition around the waist and women tend to have deposits around the buttocks. Isn't that that's a predisposition thing? Yeah.
In Indian people, we have a tendency for central obesity, which is where we get a lot of fat around our bellies and our buttocks. In Western population, obesity is more generalized. They put fat everywhere, their arms, their legs. So it's evenly. That is where we Indians are different. It could be linked to our high carb diet because we consume a lot more carbs compared to the West. But it's also a little bit genetic. And the problem with this central obesity is a bigger risk factor for hypertension, for cardiac issues, for diabetes, compared to generalized obesity. So even there is, it's not just that, okay, you are 80 kgs and you are 80 kgs, or you are 100 kgs and you are 100 kgs. Where that fat is does make a difference. Right. Someone who has all over their body is still in a better position than someone who has fat concentrated around their abdomen.
Yeah, so what Dr. Aniketh is talking about here is difference between subcutaneous fat and visceral fat, right? Isn't that typically if your fat is all over the body, that is subcutaneous fat. So that as from an outside perspective, it really looks annoying, but it actually not that dangerous to your body. Whereas visceral fat is all around your organs and all of it, and that can actually increase your risk for whatever metabolic issues or whatever health issues he mentioned. Mm-hmm. And again, we will come back to this when we talk about diet and all of it. There's a very relevant point with that.
So the basic point here is that for some people, this stubborn fat can be extremely difficult to remove. You have to do crazy levels of exercise and diet restriction to get rid of it, which is something that many people in their daily lifestyle just don't have the time or the money or the luxury to do. And this is where body shaping procedures such as liposuction come into place. I've had people who are bodybuilders and they've got a six-pack and stuff, but they have a little bit of love handle fat, as you mentioned, which they say, like, doctor, you look at me, look at what kind of lifestyle I lead, but still I'm not able to remove this fat. Right. This is where liposuction comes into play. It can help you get rid of that. It can help get rid of that stubborn fat, and this is why liposuction is a body shaping procedure, not a weight loss procedure. It's meant to help you look good in the mirror. You don't judge the result by how much you weigh on the weighing scale.
Okay. No, you're right. I mean, it's after putting in all that effort, and once you do achieve that result, it's not. Once you go back to a different thing, it's all going to come back again. It's just a matter of time before it's.
Yes.
So what would you say? Like, people have to. Do you have like a minimum criteria that people have to fit in before they come approach you for a liposuction, or before you
So for liposuction, if someone is like morbidly obese, they are not a candidate for liposuction. I would say the best person for liposuction is someone who was otherwise fit but has some pocket of fat, either their love handles or their lower abdomen or chest. They are the best candidates for liposuction because I know that they have a good lifestyle and they're going to maintain whatever results I give them with the surgery. The other kinds of liposuction patients are those who are active, who are working out, but probably not as much as I would like them to. And in them, liposuction is actually a good idea because it can help them with their workout. For example, one common example of this is women who have fat on their inner thighs. They come and tell me, doctor, I want to walk, I want to run, but every time I do that, inner thighs rub against each other and it is very uncomfortable and a little embarrassing. So for them, if I do the liposuction in that one area, then that helps them build on that and take their workout or their exercise to the next level. So this is the other good candidate of liposuction.
So a lot of people, sorry. Go ahead.
Those people don't work out at all and they come and expect me to magically fix everything for them. For them, I would advise them, I would like to put them on some kind of lifestyle modification and have them work out for some amount of time before I operate on them. Because then I know that whatever I do for them, they will be able to maintain after surgery.
A lot of people, I mean, I've had patients when I work on their diet and stuff, of course, sometimes they're still stuck and then nothing's happening. And then when I suggest liposuction, a lot of people have this misconception about liposuction being a very big procedure. What will I have to do? Can you just clear some points about how long the procedure is or how long do you take to see results or something like that?
So, there's a lot of confusion between liposuction and bariatric surgery. I think a lot of people don't really understand that. Like they come and like, isn't liposuction what Adnan Sami went through? That's not the case. That is bariatric surgery. Bariatric surgery is what you do for morbidly obese people, which is a huge surgery. You are entering inside the abdomen. You can either do it open or laparoscopically, and you are physically altering the stomach or part of your intestinal tract so that you are modifying the way you digest and absorb fat or carbs or whatever it is. So you're changing the way your body works essentially, and that forces the body to eat less, to absorb less, and burn more. That is a major surgery which is a completely different topic. It is a good surgery with the right indication. But liposuction is not that. Liposuction is a body shaping procedure wherein we are only going under the skin and we're sucking out whatever stubborn extra fat there is. Now, this can be done in some cases under general anesthesia. We do it under local anesthesia wherein you are not doing the surgery, and that makes the surgery very, very safe. It takes hardly 2 hours to do. You go back the same day and you are back to work within 3 days. So this is what makes liposuction a far less invasive surgery and with very good results. Now, coming back to the point that we were mentioning about how liposuction is only one part of the topic, how would you, if a patient comes to me and says, how do I keep the fat from coming back? What would you say to him?
So typically, so you're talking about a patient who's finished the procedure and come back, or this is just a good. So let's say the patient undergone a procedure, and let's say we have for example, you just take a moderately active person, because like you said, the various persons who come in, like you have someone who already has a very active lifestyle, they really don't need my input over there because they're already into it, they've done their reading about it and stuff. But when looking at a moderately active person to a not probably a sedentary, that range. So the whole thing I would recommend is, first thing I would recommend is take up a physical activity of your choice, because exercise is important. It's exercise and diet always go hand in hand. One can't work without the other. It will still work without the other, but no, you will not get the results that you want. So for exercise, I always tell people choose an activity that you like, because at the end of the day, it has to be sustainable, and what you need to understand is it's a habit. It's not something that you take like a tablet for 1 week, 2 weeks, or 1 month and then stop. But it has to be a habit. So if you're into dancing, you like dancing, you want to do Zumba related exercise, go ahead, do Zumba related exercise. You like running, you like jogging, stick to running. You like hitting the gym, go to the gym. Not everything works for everyone. So you need to figure out, it might take a little bit of trial and error to figure out what exercise works for you. So you figure that out, figure out what works for you, get that sorted on the exercise thing. And again, with respect to what exercise you take, it has to be done on a repeated basis. It has to be done consistently. You have to at least 5 to 6 days a week. You need to be putting in some amount of exercise for about 45 minutes to an hour. That's depending on the type of exercise. Along with that, the diet is a big thing. Diet's really, really important. Figuring out, like I said earlier, like about how people have this tendency of eating less, working out more, eating less, working out more. That doesn't work because you're looking at only fat and calories in gross. Calorie deficit is very important, but the way calorie deficit works is you need to work out more, eat more. That's how calorie deficit works. You can't take it both in the opposite directions. Yeah. So talking about when it comes to diet, there's some things that you can do. Yeah.
I hope you don't mind I'm interrupting you. Just to come back to the exercise part of it. I think people don't realize that exercise should be cardio plus strength training. What do you think about that?
Right. So yeah, thanks for bringing that up. So cardio, so a lot of people. It's changing now. The trend is changing now. Initially, the trend used to be that low, like I said earlier, how low intensity exercises burn more fat. So people just use that and think, yes, to a certain extent, you will burn a lot more fat. But then beyond a certain point, if you're not building in muscle mass, your fat loss is going to stagnate. That brings us to something called as the resting metabolic rate or something in the body. Resting metabolic rate is basically if you don't do any physical activity or anything, how many calories your body will burn. So typically it's around 1400, roughly it's 1200 to 1400 for women and 1400 to 1600 for men. But again, this can vary. These are all data based on Western people. I think Indians by default have a slightly lower thing because we also have a slightly lower muscle mass. And this is where muscle mass plays a role. Because the more muscle you need to be, I say muscle mass, not talking about bodybuilder level muscle mass. It's more like, just some basic toning, just lifting some weights. The muscles don't have to show on your body. You can have good muscle mass and it doesn't have to show on your body. So that's so it has to be a combination of both. It can't be just strength training. It can't just be weight training. So I would say find the right trainer, find someone who understands your needs, who's not just going to copy paste what his trainer taught him or not going to copy paste what he did for all the other clients of his, because this has to be highly individualized. Because now, for example, say people who undergone like you said, you spoke about post-pregnancy women or thing. They might have developed a little bit of muscle weakness also post a procedure and stuff. So you need to take so many things into. So don't follow a generalized program. I would say try to get it customized to you as much as possible, and then go ahead. Yeah.
So just to put in a nutshell what you said, first find a activity that you like, that you feel like doing. Secondly, see if the activity is enough, both in terms of cardio. Cardio would be energy burning stuff like running, cycling, etc. And could also provide you with strength training. Strength training is what builds up your muscle mass, such as doing weight in the gym or doing free body weight exercises such as your Insanity or your HIIT or whatever. Yeah. So the whole point that people need to understand is if you do strength training, you're increasing your muscle mass. Muscle burns more fat, so your basic metabolic rate is going high. So it is not that you shouldn't look at putting on muscle mass will increase your weight on the scale, and therefore you should not. The number on the weighing machine isn't the end all be all. It's okay to weigh a little bit more if the proportion of muscle in your body is higher and the proportion of fat is lower. And the more muscle you have, automatically the amount of fat goes down. So this is why strength training is
very important. And one more advice I like to tell people about is that people, like you said, the weighing scale, because you brought up the weighing scale, people tend to measure their weight every week or every day or whatever. See, but the important thing to be focusing on is the inches. The inches play a big role because that's why you can actually measure your fat thing. Because 1 kg of fat gives us it's such a loosely bound tissue. So 1 kg of fat looks like this. whereas 1 kg of muscle will be all contracted and thing. So for anyone who's monitoring their progress and thing, I would say focus more on the inches than on the weight, because even when you're losing muscle mass also, it will show a loss on the weighing scale. That can give you a false positive thing that, hey, I'm doing well, I'm really doing well, I need to continue this activity and stuff.
Yes. Yes. So now we can come to the diet part of it. So before, I think we all grew up in school learning the food triangle, where you have carbs on the bottom, then you have proteins, and then you have fats on the top. And
Right.
I think recent knowledge suggests that this triangle might not be entirely accurate. What do you say for that?
Right. So I don't think we need to look at it as a triangle anymore. You can either look at it as a square or either look at it as a sphere or something. See, because we need to understand based on what the triangle was designed. Because when the triangle was designed, what we saw in school was something designed in the 60s and the 50s and stuff. When everything required manual labor, everything required physical activity, So obviously that time it made sense to have carbs because your physical activity is so much, everything was burned. That's why you always have your granddad or your grandmom telling me so much. I used to eat like 6 chapatis, or I used to eat so many, whatever. And you're like, dude, I can't even eat that for my whole meal for the whole day. I can't. Yeah. So, but those guys have so much physical activity. That's we have a very sedentary lifestyle, and that is one more. So that's one more. Sorry, what we yeah. So the food triangle is something. Yeah, the food triangle is something that's been thrown out of the thing. At least non-traditional people seem to have thrown it out. So what's happening now is that people tend to because of we have to modify our calorie intake or our food intake according to our lifestyle. Like someone who's a pro athlete, or who's into high activity can still follow that food triangle. It doesn't change too much for them.
Because they're burning
it, and that's thing. But the rest of us, even though we say that, hey, we're working out 1 hour in the morning and doing high intensity interval workout for 1 hour in the morning, and I burned 800 calories or 900 calories in that session, but the rest of the day we're sitting on our butt. We're not really. Most of us. I'm not on all of us, but most of us have a sedentary. Like we have desk jobs or all of it. So what happens then is that doesn't account for the whole thing. Couple of things. It's not only the proportion, it's also the timing of food.
Yeah.
Because coming back to the proportion, I diverted a bit. Coming back to the proportion, what happens with the proportion is that you also every ingredient has its role or thing to play. Carbs have its role, fat has its role, protein has its role. So I would look at it as a more a squarish approach or a spherical approach. You divide it into a pie chart and try to figure out, depending on your activity, this suits you better. It's a very dynamic. It's a dynamic thing.
Yeah.
It's a very dynamic. Yeah. But like I said, now along with proportion, timing is very, very important. Now, a lot of people advocate having a very light dinner, having dinner as early as possible. Now, because your activity post dinner is usually quite minimal, right? So, what happens then is that when you say you have like your regular rasam rice and your curd rice or your biryani or anything for dinner, and now you're just going to go lie down or maybe go sit around, watch TV for an hour or so and go sleep.
Yeah.
What happens then is all this. All the carbs that you consume gets converted to fat. So along with the proportion, timing is equally important. Yeah.
So before coming to the timing, in the proportion, the other thing I would like to touch on is the fact that in Indian diets, traditionally our protein intake is very much on the low side.
Right. So that might also explain why we have I'm not sure this is connected, but it might also explain why we tend to have a abdominal predisposition of thing compared to just because of the low protein thing, that also tends to cause a little bit of abdominal central abdominal thing. Yes, because Indians again come from a by default come from a labor background or thing where we used to, or the agriculture background or thing. So that is, again, the awareness is changing now. I'm happy about that. People seem to be a little more protein conscious, and I'm glad they are. And people have a misconception that it's only non-vegetarians who can get protein, but that's been tossed out of the window. So protein is something you will have to figure out. You will have to include it in your diet. Again, this is highly customized because depending, as you see, the South Indian has a different diet, the North Indian has a different diet, a Maharashtrian has a different kind of diet, depending on what source of vegetables, what sorts of pulses or dal you have around you. So the whole, in a nutshell, what I would say over here is to try and get as many different types of proteins or from different sources, put it together and eat it. That should cover your protein intake. Try not to depend too much on supplements. Yeah.
I would say that in Indian diets, especially South Indian diets, the focus should be on reducing the carbs a bit and increasing the proteins.
Right. That's true. That's absolutely right.
So now coming to the point you mentioned about timing, what would you say? I know there are various different theories on this, but what in terms of someone who has a 9 to 5 or a 9 to 6 job, what would you say would be a good way for them to divide their meals? How many meals a day? At what intervals? Which meal should have less? Which meal should have?
Yeah, right. So that comes down to two things. One is, can you control your portion size? Can you not control your portion size? If you're someone who can control your portion size, if you're really good at controlling portion size, then multiple small meals work. Mm-hmm. Because you know that, hey, if I eat that one chapati, I'm not going to eat it again. I can eat it after 2 hours. Someone like me, I have an issue.
What does multiple mean? How many?
Multiple small meals can mean, let's say take the average person eats 3 meals a day, right? Mm-hmm. So the average person eats breakfast, lunch and dinner. So you can break down to 6 meals in a day. Divide your breakfast into 2 parts. Have, let's say you have breakfast at 8 o'clock, lunch at 12 o'clock and lunch at 1 o'clock, which is a typical usual lunch break, lunch at 1 and dinner by 8 o'clock. 8, 8. If that is your 9 to 5 person, I'm assuming this will be their rough eating thing. So in such a situation, what you can do is, if time permits, again at work and stuff, you can probably have a meal at 8, like a half your breakfast at 8, and maybe give it some time to settle down, give it some time to digest. Again, have a little bit around 10 or 11, then a little bit around 1, then a little bit around 3 or 4. So what happens in such a situation, the theory behind multiple small meals is that when you keep giving your body a little, it tends to, it's like you're slowly giving it fuel. So it keeps burning throughout the day, because some people say that the body, like the moment it doesn't get any food, it's like, okay, I'm not getting any food. So it tends to go into an anabolic process or a storage process. That's the theory behind multiple meals. You just keep giving it enough to keep going, so that it doesn't take. But at the end, and the other one is, in case you have portion control issues, like if I eat 2 chapatis or something and then I'm still feeling very hungry, I feel very empty and stuff, and that can be a big issue, because if you're still feeling that emptiness in your stomach or anything, then you find it very hard to work or focus at work and all of it, or you can get cranky and get angry with people around you and all of that. So in such situations, that's why the concept of having 2 big meals in a day or 2 big meals in a day and get done with it, so that eat till you're happy and take. So that's why the whole, even the whole concept of intermittent fasting, which is the current trend, everyone seems to be following intermittent fasting and things. In terms of if you're doing 2 big meals a day, then intermittent fasting would be a good way to go about it. There are multiple formulas. That you can do a 12-hour, there's a 16, 8-hour, there's a don't eat 1 day a week or 2 days in a week you don't eat and then you eat normal meals. So there are multiple formulas. So intermittent fasting, but intermittent fasting is for someone who have portion control issues. That's something I would recommend for them. So yeah, that's the timing.
If you're able to control your portions, then small amounts every 3 to 4 hours, maybe 6 times a day would work well.
Would make more better. Yeah.
If you're not able to do that kind of control, then eat properly, big meals, but finish your meals off in a 12-hour period.
Absolutely. And one more point about timing is that again, like we kept talking about carbs, fats, protein, and all that thing. So the other thing is you need to time your carb intake as close to your exercise as possible. Okay. Your maximum concentration of carbs needs to be as close to your exercise as possible, because
close means before or after?
That's up to you, depending on when you exercise. For people who exercise in the morning, it might be hard to eat breakfast and thing. For people who exercise in the evening, it's probably easier to eat a little before and come. So it doesn't matter. It really doesn't matter. But as either before or after thing. Because if you do it before, you're going to utilize it. Again, there are 50% of people, the studies say that you should work out on an empty stomach. 50%. See, at the end of there's so many studies out there. Whatever works for you works, because thing. So that's very important. That's why you try to avoid carbs at night if you're working out in the morning, because you don't have any physical activity at night. Yeah.
But either way, you're trying to avoid carbs just before you sleep, right?
Absolutely, right. Unless you're a night shift person, then that's a different thing.
So if you're doing the multiple small meals a day idea, then you put your carbs just before you work out or just after you work out. You don't put your carbs in your last of the day.
Right. When you're most sedentary, you don't put your carbs. Yeah.
And if you're not doing multiple meals, if you're doing 2 or 3 big meals in the day, you either have your carbs in the morning if you're doing your workout in the morning, or you have your carbs in the afternoon if you're doing your workout in the evening. You try to avoid carbs.
Yeah, that's a takeaway message. Yeah.
So there is one good question that we've had just now by Dr. Manjot. Protein intake should be more during the daytime or dinner time, or is it related to your workout? How would you time your protein intake?
So that's we all, when I was a swimmer, when I grew up with the wrong thing that you have to have your protein shake right after your workout. That's very important. Otherwise, you lose muscle mass, you lose this. That has been tossed out of the window. Honestly, protein, you can take your protein any time of the day. And people have this big, if you see a bodybuilder diet or anybody who says high protein diet, I'm going to have 12 eggs, 12 boiled eggs, 10 boiled eggs, and all of that. Now, what I would, Dr. Manjot, right? What I would recommend, Dr. Manjot, is divide, unlike carbs, protein intake is something you want to divide through the day. Because what happens is your body has a limited capacity to digest, metabolize, absorb, make use of the proteins. Now, let's say I eat 1 gram of egg, one egg uses about 4 to 5 grams of protein. Now I eat 10 grams, 10 eggs or 12 eggs. I'm taking in like 40, 50 grams of protein. What happens in that situation is that the body will probably utilize about 15, 20 grams of protein. The rest of the protein is wasted, or it is converted to carbs or fat. Well, mostly fat. I had broken down to carbs, so it's changed. It's not utilized. There's something called as protein oxidation which happens, which is of no use. So I would say what you need to eat immediately after the workout is carbs, because that's the energy thing, that's your thing. What you need to divide your diet throughout the day is more a protein-based diet or a fat-based diet. So I would say protein intake divided through the day. You can even have a high protein meal for dinner also if you want to. That's absolutely okay. I hope that answers the question.
Not to focus all your proteins in one shot. People put 50 grams of protein in a shake and chug that shake. That's not going to do much.
Again, if you worked out, it's not going to. Just the shake on its own is okay, but then having the shake, then the eggs, then I've seen when I've gone to.
What meant by that is they think they've gotten their entire protein intake from that shake, but it's not because the protein is not absorbed.
Yeah, absolutely right about that.
Okay. One question coming right now is, if I'm doing an endurance-based workout in the morning, won't carbs be an important part of my dinner the previous night?
So it depends on your thing of an endurance workout. Like if you're running you have a 30-kilometer run tomorrow, or if endurance-based workout, if it's going to prolong for more than 2 hours or something, then you can have a carb-based thing. See, what you need to understand is whether you're doing the endurance-based workout for performance, are you doing the endurance-based workout for fat burning? You need to understand that sports performance and weight loss don't go hand in hand. Because sports performance people need that carbs. People who are trying to lose weight don't need that carb. So if you're someone who's overweight and who's doing an endurance-based training the next morning, then I would say no, you're not, because your thing is not, you're not looking at sports performance. You're looking at getting rid of all your extra fat. But you're doing endurance.
So fast you can run that 30
Exactly.
Lose weight.
Exactly. It can be running, it can be any endurance-based activity. Swimming, cycling, or anything for that matter. So that's very important to keep in mind. If you're, if you're an athlete who's looking at performing the next morning, then
times doing faster than that carb the previous night will.
Yes, that's absolutely right about that.
Okay.
So
another question we had is,
there's something wrong with my audio. Sorry, there's a lot of static. I can't.
You want to change something?
1 second.
So if anyone else has any questions, do send them to us.
Yeah,
we have
much
a couple
better
more
now.
to discuss.
Yeah, okay.
Yeah. The question we had is for someone who has not paid much attention to their diet or their workout so far, someone who's just come to you for the first time. What would you stress on first? Would you stress them changing their diet first, or would you stress them starting exercise first, or is it both?
It has to be a parallel approach. You can't. Linear approaches don't make. Linear approaches can be a little more frustrating. Like you can't be like, because see, for someone who's not done any of this for a while, what happens is it takes some time to see results. It's not like I exercise today and I'm going to see change tomorrow, or if I diet for these 4-5 days, it has to be a parallel approach. And very often I tell people the target is to get fit first.
Mm-hmm.
Get fit, see if you can make this a sustainable habit. It's not something that you get obsessed. What happens is if you get obsessed with just a weight loss, or you just get obsessed with just a fat loss, if that is your target, it can be quite demotivating, because weight loss doesn't follow a linear pattern. It has its fluctuations up and down and stuff. So I would say what I normally tell people who come in like that is to first get yourself into the habit of exercising regularly along with it. It has to be a combined approach. You can't say I'll do this and only this, and then if that works, because very often I hear people saying, when I tell them, why don't you join a running group, they'll be like, no, let me walk for some time, let me get fit and then join. So that's a very linear approach. You want a parallel approach so that everything both work hand in hand. One can't do without the other.
Yeah. Another question we had is, what do you have to say about a water fasting diet? Be it 24 hours, 36 hours or 48 hours?
A water fasting diet. So, I wouldn't. See, now when you go based on a religion thing, there are the various religious theories that some people fast alternate days, some people fast 3 days on the trot, some people fast 2 days on the thing. Now, fasting has its benefits and all of it. And personally, I'm not a big fan of water fasting, because I don't see how how you can sustain physical activity and all of that on water fasting. So if you're not going to be doing any activity for the more sedentary you are, the lesser your physical activity is going on for the next 1 or 2 or 1.5 days, then you can sustain that water-based activity for a longer period of time. But if you're going to have a lot of exercise and thing, I wouldn't recommend doing a 24-hour. 24 hours is fine. That's absolutely fine. But you also want to make sure your physical activity is actually limited. So that it also comes down to your physical activity thing. Personally, I'm not a big fan of fasting for 24, 36, 48 hours. But I've had, I think it's very common in the Jain community where people fast. They really, this is like solid fasting. And I've had issues with them because when I tell them, no, you need to take this tablet, they're like, no, I'll start it only tomorrow morning, or I'll start it after 3 days because I'm fasting for the next. And it's good because it's been shown to a lot of, it's been shown to control a lot of issues like diabetes, high blood pressure. It's got it under control. Unfortunately, we don't have too much research-based work on that to show the evidence. It's all like it's more about it's like case studies, like I've done this, I felt this benefit. I've done this, I felt this benefit. So, yeah, not a big fan, but if you can do it, you can think there's no harm in doing it as long as you keep your physical activity also.
I think this also brings up the question that there's a trend nowadays to follow whatever the new fad is. First, there's the fad of keto diet, and everyone was doing the keto diet. Then it was intermittent fasting, and everyone was rushing to the intermittent fasting. So, do you think it's a good idea to just jump on one bandwagon to the other?
So, see, all these the intermittent fasting, keto diet, different types of patterns, and multiple small meal was also one trend like that before the keto and all of that came into it. It's okay to switch from one diet to the other as long as it's done in a guided manner and things. So when I put somebody on a keto diet, or when I ask someone to go on a keto diet, I always tell them to do it for at least 4 months to 6 months, or for 3 to 4 months. A lot of people have the tendency to do it for a month, 4 to 6 weeks, and then you're like, because it's a plateau. I mean, you plateau for some time, and then after some time, you again see that. So the people who jump from bandwagon to bandwagon are typically people who stop seeing results. Like any diet plan you follow, any exercise plan you follow, in the initial phase, you see like a good weight loss. Then the slope is you kind of stagnate, slow. And then that's when they see that stagnation for about 2 weeks, they jump. Sudden jumping is not recommended because, and I would also it's very important that you do it under guidance. Basically follow someone's guidance. It's okay. There are multiple diet methods. They're all good. It's all comes down to what do you do more consistently, what works for you. Because you can have people who've lost the same amount of weight, who look absolutely stunning, who looks absolutely as aesthetic as they can get, and think following two radically different diets. Like keto was all about meat and fat and all of that, and then you had the Game Changer on Netflix, which was all about going vegan, showing people going vegan also you can get the results. So it doesn't matter. It's all about being smart and being consistent. So that's important.
Yeah. So now, just as diets can be different from different people, I think a good point to mention is that even exercise regimens need to be different. A 20-year-old person and a 50-year-old person can't be doing the same kind of exercise. So, what kind of different? What would you say are some of the differences that a younger person should be focusing on, and what an older person should be focusing on?
So you also, this is where you take into again. Now, if it's a younger person who's been now again, you can subdivide the exercise. Same way you can have an older person who's been a sports person or an athlete throughout his life, and an older person who's never exercised, right? So based on this, you can.
Let's keep athletes out of this, because I would say that proper athletes like you would represent maybe only 5% of the population.
Okay.
Let's say it is someone. Let's say someone who is a 9-to-5 job that is pretty much sedentary.
Okay. Yeah. So if you're a 20-year-old person, man, you can maintain in terms of ratio and all of. I would say in terms of ratio, you can maintain the same muscle, like the same in strength workout to cardio workout. You need, because whether you're young or you're old, you need muscle mass. The only change I would make is for an older person would be to focus more on building strength and a little less on the endurance aspect. Okay. Yeah, no. You do a little more gym or do a little more strength-based workout, because as you grow older, you tend to lose muscle mass. Let's say once you cross your 50s and your thing, you tend to lose muscle mass. So your focus should be on, an older person's focus should be more on building the strength and less on the cardio. But even when you build up your strength, you do your strength-based workouts, also your heart rate shoots up. It's not like if my resting heart rate is 60 or something, it's not like when I do my strength workout, my heart rate is only 70 or 75. That also brings my heart rate to 110, 120 or 130 and all of that. So, elder population, I would say focus a little more on strength-based routine. If I had to divide your workout into percentage and say it is 60% strength training and 40% cardio-based activity for people who want to lose weight, or 50-50 for younger people, like just giving it up. It's a 50% for young, 50% strength, 50% cardio for younger people. For the older people, I would probably change that ratio to about 60 to 70% strength and 30% cardio. That would be the specific exercises. First, again, it goes to what you want to do. Because
the older you get, also your body starts revealing certain issues: neck pain, back pain,
knee issue, back issue. Right. Absolutely right.
You have to modify your workout to focus on those particular areas so as to offset that. Like, I know, being a surgeon, I have a lot of lower back issues. It comes from years of bending down and all. So I have to do a lot of glute training, a lot of core training to offset that, so that I'm able to do my job. So as and when you get older and these issues start presenting themselves, you need to modify and adapt accordingly.
Right. I mean, we also have a friend who has a neck issue also. I mean, like, he can... I mean, just examples,
So, Dr. Pratima asks, so similar to at least sticking to one diet for 4 to 6 months, how long should you stick to exercise regimen? Is it wrong to have one pattern of exercise regime for a few years?
So if you're looking at, when you look at it from a weight loss, I'm going to talk about weight loss perspective and I'm going to touch into performance perspective. Okay. When you're looking at weight loss perspective, it would be recommended that you change it. Not more than every 6 months or 4 months. If you can change your exercise regime, that would be a very good. That would be a good thing to do, because the human body is extremely smart. It knows how to adapt. It knows how to change. You have people who. I've seen long distance runners long distance open water swimmers and all of that. These are guys who run 70 kilometers, 80 kilometers over the weekend. It's not like, or 150 kilometers over the week or 120. But then they still have the typical thin arm, thin leg, but they have that abdominal protuberance and abdominal fat thing. So you've been running for so long. Now what happens is when you do the same physical activity over a period of time, your body tends to learn how to burn or learn how to do that activity optimally. Like for me now, people say swimming is an excellent way to burn calories. They say if you swim for 1 hour, you burn 500 calories or 600 calories. I'm just giving rough numbers over here. Yeah. Now that might be true for someone who's just learning how to swim or just gotten into swimming. For me, if I ask me to just casually swim for an hour, I might burn like 100, 150 calories at the most, because I've been doing it for so many years.
It's figured out how to do it without burning as many calories.
Exactly. So the more you challenge your body, the more chances of burning your fat.
Yeah.
And
you can't radically change your exercise regimen. If you can at least tweak it a little bit and make it a little bit different, it'll help.
Yeah. And also you get bored. I mean, just for variety. Your motivation to learn something new, your motivation to do something different is higher. So I would say change exercise every 4 to 5 months, or once you're stagnating a lot and you're not seeing any result or something, then change. Absolutely.
Ultimately, nothing you do should really make you miserable.
It shouldn't. Exactly. It shouldn't come at the cost of enjoying life. There's what are you doing it for? You want to. You're right. The initial few days might be hard, but if it continues to be hard, you continue to suffer or something, then it's not worth. Find something that keeps you happy. It's not going to work for you also. That's a thing.
Yeah. One question I had from Dr. Pratima, being an orthopedician, this makes sense from her. How soon after liposuction can you undergo an elective procedure like an arthroscopy or a joint replacement? Liposuction, when it's done under local anesthesia, is quite a mild procedure. In terms of being medically fit, you can do another surgery within a week or so. Now, the other point is that when you do another surgery, there might be some rehab involved with that surgery, especially with a joint replacement. And you need to be fit enough to do that rehab. So keeping that in mind, I would say that you should space around 6 weeks in between the two surgeries. This would be my recommendation. So I think we can wrap it up over here. We're not having any more questions coming in.
Okay.
I think ultimately what we have learned today is that there is no one size fits all. There is no one way to do things. Be it workout, be it diet, you need to find what works for you. And finding what works for you be a little bit of a process. It's not like you start on day one and you have all the answers. But what is important is that you start. And as you start getting questions, you read up more about those questions, and you ultimately figure out something that works for you. You modify it in such a way that it suits your lifestyle and you're able to get results from it. And if you, there are a lot of sources that you can get help from. You can also consult Dr. Srinand if you like. His Instagram handle is sports.shri. So there is no one size fits all. There is you can get results through a whole variety of exercise and diet regimens. But what is important is that you do focus on your diet and you do make exercise part of your life. As long as you're doing that in some way, shape, or form, that is a good place to begin.
Yeah, absolutely right. Because again, like this, bringing back the whole liposuction, coming back to the liposuction thing. Sometimes when people are working out and all of it, and they don't see those initial results. Or you're like, hey, I see this fat on my tummy the whole time, and I'm like, whatever I do doesn't work and stuff. So for all you know, like once you undergo that liposuction and you get that fat thing removed, and now people are like, hey, now I got to maintain my body, and that liposuction can be the trigger for you to start an active lifestyle and stuff. I think, so that is one thing. And and then the other thing I wanted to bring up is just about liposuction and thing. A lot of people are scared about when I've had liposuction. Now my skin is around that area is stretched to accommodate that liposuction. So what happens to that skin? What do you do to that skin? Like
now that there are two parts to this. In a young person, that skin usually contracts back. The human body has a great ability to adjust itself. Like if you look at a pregnant woman, so much extra skin, but after pregnancy it all goes back in. That is what usually happens after a liposuction. To help it needs a compression garment. Now there are a couple of cases where this doesn't happen. It doesn't happen in someone who has had a huge weight loss, like someone who has gone from 120 kilos to 70 kilos. Someone who's undergone huge weight loss, their skin is usually damaged and it does not contract. Another situation it happens is like women who had multiple pregnancies. In them also, there's a lot of extra skin which doesn't go back. In those people, unfortunately, the only way to get rid of that extra skin is by removing it. It's a procedure known as a tummy tuck or abdominoplasty. That's where you have to remove that extra skin, and you will end up with a small scar from that surgery. But by and large, most people who undergo liposuction, this is not an issue. The skin contracts back quite well.
Okay. That's good to know. Because that's a very common fear among people. What happens to my skin? I don't want saggy skin, and that's that should clear a lot of doubts. Yeah. Any more questions?
So, no, doesn't look there's any more. There is one question from a stranger called Rao Diksha who says, Dr. Srinand, please help me burn my stubborn abdomen fat.
So,
I suppose she can set up an appointment with you and get that taken.
Discuss that separately. Yeah, that sounds good.
All right. Thank you so much. Thank you so much for taking the time and everyone for joining us. So, do follow Srinand on his Instagram account. He keeps posting a lot of good workout videos and diet tips, which could help you out. And if you have any further questions that you think of later, you can DM them to either of us. And take care, stay home, stay safe.
Thanks for having me over. See you.
Bye.
Bye.